Hi guys, I'm Dr. Zainab Vora, your mentor for radiology on the Unacademy platform. I have done my MBBS and MD in radiology from the All India Institute of Medical Sciences, New Delhi. I have come up with this short high-yield video on obstetric ultrasounds and the must-know points regarding this. So you get a lot of questions from the various signs of early pregnancy, what structure appears when, what are the various measurements we use for dating a pregnancy. So all of these are very, very important. So this short video will take care of all your questions about the obstetric ultrasounds. So before we start with the topic, to quickly orient you towards Unacademy and what we are all doing there. So it's a live learning platform that you all must be aware of, where you have a lot of live interactive classes with educators from all the subjects. In case you have still not checked it out, I urge you to download the app. Lot of free special classes are always going on throughout the day. So check it out, and if you like it and you want the unlimited subscription, use the code which is ZVORA in order to get a 10% off. So depending on your preparation time and your target, you can get a variety of timelines of subscriptions that you can check out. And also basically now Unacademy has come up with this iconic subscription where you get Unacademy as well as Prep Ladder, which will serve as a one-stop shop for all your PG needs, where you have live lectures as well as recorded lectures from the top faculty at Prep Ladder. So this is a combined package where you get everything in one subscription. So this is highly recommended for those of you who are in your third year, in your final year, who are starting to now prepare. So this will be a very good resource for you all. Apart from that, also Unacademy has this NEET PG T20 series going on, where we have MCQs, mock tests every day at 8 o'clock. So again, this is something you should check out. So now let's begin. So our first question is arrange. So again, sequential arrangement is asked very frequently in your INI CET exam now, or your previous AIIMS pattern, where I am asking you to now sequentially arrange in order of appearance these four structures. So what do you think is the answer? You can type in the live chat, or you can type in the comment section of what you think is the right answer. So let's analyze this particular question here. So in order of appearance, remember, the first thing that will always appear out of these four, first of all, the very first thing which is not even in the option is what? It is the Gsac. And what I have indirectly asked you, what are the signs of Gsac appearance? So again, I'll be talking about this, but there are two signs of Gsac. One is the intradecidual sign and the other one is called a double decidual sign. So here, number 3 is basically pointing you indirectly towards a gestational sac. After the Gsac appears, what is next to appear? The next to appear will be the next sac, which is your yolk sac. So the yolk sac will appear following which the embryo starts to appear, and once the embryo is fully developed, then the fetal cardiac activity starts to develop. So basically this is the sequence of events. So if we look at the options, number 3 is the first, so it's either B, C or D. After the double decidual, we have yolk sac, so we have 3 and 1, so option D, option A are ruled out. So then after 3 and 1, we have embryo, and then we have the cardiac activity. Correct? So this is the correct option here. Now let's look at all the details of the following structures that I have named for you. So this is the order in terms of gestational age. Now, we can do obstetric ultrasounds or uterine ultrasounds in two ways. One is the TVS, which is the transvaginal ultrasound, and the other one is transabdominal ultrasound. Now, which has a higher resolution? Remember, when we do a transvaginal sonogram, we are keeping the probe inside the vaginal cavity and having a closer look at the uterus. So, anytime we want to look at any of the structures, TVS will always be ahead. Alright, it will be ahead of the transabdominal ultrasound. So it has this advantage of giving the same diagnosis 1 week prior. Okay, so it has this advantage of 1 week that it gets. Right, so as you see here, that this number is the only number you need to remember. This table looks very complex, but it's not complex at all. You just have to remember this one number. When does the Gsac appear? So remember, the Gsac appears at 4 to 4.5 weeks period of gestation. This is when I will see it on transvaginal sonography. Now, it's very easy. Now, everything else becomes a cakewalk. So, TS, we know it's lagging or it's late by 1 week. So, we just add 1 week here. Then what do we do? When I ask you yolk sac, you just take this here. You just take this number here. Then again, when you ask about TS, you add 1 week. Then when I ask you when does the embryo be visualized on TVS, you just place this number again here. Alright, and then when I ask you about TS, what do? Simple, you add 1 week. Similarly, fetal cardiac activity, the last thing that I will see in the developing embryo here, appears at 7 to 7.5 weeks, same number placed here, and then in TS you add 1 week. So you see how it's so easy to remember this entire table just if you remember when does the Gsac appear. And this is a very important number that I want you to remember, alright, because this will be asked when does the Gsac appear, or what is the earliest time when the pregnancy can be diagnosed on ultrasound, especially on TVS. Alright, so I hope this table is clear, this concept is clear. Now let's look at the images. Alright, now let's look at all the images of the various structures. So the first one we saw was Gsac, and when was it seen? We already know 4 to 4.5 weeks, or to be precise 4 weeks 5 days. Alright, so this is when it appears. Now as the name suggests, it is a gestational sac. It is a fluid containing structure which develops in the endometrial cavity. So this is a transvaginal ultrasound that you are seeing. This is the uterus. Can you see how large it is appearing? So this is the uterus basically. So the resolution is much higher when we do a endocavitary or a transvaginal sonogram. Alright, so this is the uterus, this is the myometrium, anterior myometrium, posterior myometrium. This hyperechoic thing that you are seeing, this is the thickened endometrium. And within this endometrial cavity, we are seeing this sac, fluid containing cystic collection. Right, and how do we measure this? So we measure the mean sac diameter. We take the measurement in 3 axes and take the mean, which will tell us about the exact period of gestation. Alright, so mean sac diameter is what we measure here. As a general rule, remember it keeps growing, and it keeps growing by 1 millimeter every day in the early pregnancy stages. Now, there can be a lot of pseudo cavities also, a pseudo cyst also, which can develop here, pseudo sacs as we call it. So how do I know that it is indeed a pregnancy related gestational sac? So for that, 2 signs have been described. What are the 2 signs? So the 2 signs are called the first sign. The first sign that you can see, again a repeat NEET question, that what is the first sign of Gsac that you see? This is called the intradecidual sign. ID, I'm just writing ID here because some issue with the pen again. So this is an intradecidual sign, that will be the first sign that you see. What is intradecidual sign? So that sign refers to this eccentric location of this cyst. Alright, do you see this, how it is thoda sa eccentrically placed? It's not in the very center. So this eccentric location within the endometrial cavity gives its name intradecidual sign. The second sign, which is very important, is the double decidual sign. Alright, it is the double decidual sign. So what is the double decidual sign? In the double decidual sign, we will see that surrounding the Gsac, do you see this Gsac here? Surrounding the Gsac, you have these 2 decidual layers. How do we remember which 2 decidual layers make the double decidual line? You have to remember capsularis and parietalis. Remember CP, Connaught place. So this is the 2 decidua which will surround the Gsac, capsularis and parietalis, whereas basalis forms the other end. Alright, so they will ask you double decidual sign is made up of which 2 decidual layers? So CP, capsularis, parietalis. So these are all the things you have to remember about Gsac. The very first structure to be seen, 4 weeks plus 5 days, eccentrically placed, called intradecidual sign, will be the first to be seen, and you will see a double decidual sign where you see capsularis and parietalis forming 2 walls. Alright, so this is the first thing. Now what was due to develop in the next 1 week? We had the yolk sac. Now, very important point here, that once I see the yolk sac, now I know that this can't be a pseudo sac. This can't be some unrelated fluid collection in the endometrium, correct? This has to be intrauterine pregnancy. So this is basically the sign that confirms intrauterine pregnancy. Alright, very important. Next, what do we have? After the yolk sac develops, we have the embryo or the fetal pole which develops. Okay, and this appears 1 week later. So after the 1 week that the yolk sac had developed, we will have the embryo or the fetal pole which is gonna develop. This is gonna develop around 6 to 6.5 weeks. And one very important point, that I should be able to see the embryo or the fetal pole when the mean sac diameter is around 25 millimeters. Alright, extremely important. So this is a very important point, that once the sac assumes this size of around 25 mm, I should be able to see the embryo. The embryo must now have come. Otherwise, this is a poor prognostic sign. This is a sign that there is early pregnancy failure. Alright, very important. I will be talking about this, but for now remember, once this sac assumes a size of 25 mm, you need to know that embryo should be seen. Okay, and again we measure the length of the embryo. What kind of length? We measure the crown to rump length, from the head ka top to the buttock ka bottom. We measure the crown to rump length, which is very important. This is the most accurate measurement that you will take to determine the period of gestation. So if you see here, this is the yolk sac. This was the Gsac that it developed. Then you have this yolk sac, and now the fetal pole has started to appear. This is the earliest most part of fetal pole that you will see. Now, what was next due to appear? The final thing that you have to see is the fetal heart rate. Alright, and the fetal heart rate should be present when the crown rump length reaches a diameter of 7 mm. Very important. Alright, so this has to appear once the crown rump length reaches 7 mm. Otherwise, again, this denotes a early pregnancy failure. Alright, so these are two very important signs that we will be again consolidating upon. Now the baby has grown up a bit. Now we are past that early stage, correct, when the fetus was just a fetal pole. Now the fetus has assumed this larger size. This is the first trimester ultrasound again that we are still on, and this measurement is being measured. So based on this, all of the following are true about the parameter measured, except, so first of all you need to guess what is this parameter that I am measuring from here to here. Again, there is a clue in the image. We are seeing something. So what is this parameter and what is the correct statement? So yes, as you can understand here, we have a line which is going from the crown to the rump. This is the crown rump length. Alright, we are measuring this length of the fetus here from the crown to the rump. Okay, now is this the best parameter for gestational age? This is correct. Remember, crown rump length, which is measured in the first trimester, can give us the most accurate determination of the period of gestation. Alright, this is the most accurate out of all the trimesters. This will give me a very high accuracy of the fetal age. Second, when is it measured till? So it is measured only in the first trimester up to the 13 plus 6 weeks, basically 13 weeks plus 6 days. Alright, so 13 weeks plus 6 days tak we can measure the crown rump length. Is it measured with maximum neck extension? Now you have to understand that when the fetus will flex the neck, what will happen to crown rump length? It will apparently reduce. When the fetus is in maximum extension, what will happen? The crown rump length will seem falsely increased. So that is why we always measure the crown rump length. We have to take care that the neck should be in neutral position. There should be no flexion or extension. The baby's neck should be neutral, as you are seeing here. Alright, so this is wrong here. It is not in maximum neck extension. It should be neutral. And again, what kind of plane have we chosen? As you can see, this is a mid-sagittal. Correct. We choose the mid-sagittal pole of the fetus and we will measure the crown rump length. And again, as we discussed previously, the CRL, which becomes more than 7 mm and cardiac activity is not there, we will call that missed abortion or early pregnancy failure. This is also a true statement. Alright, so this was about crown rump length. And one trick to remember in exam, if they give you the crown rump length, although in the real life, in computer, we already have the settings about all the expected CRLs with various period of gestation. So as soon as I measure, the system automatically gives me the POG. But for exam purpose or just for a quick reference, remember that the period of gestation in days approximately will equal the length of CRL plus 42 days. Okay, so this is just a quick formula that you can remember. Now, in the first trimester, as a part of taking about aneuploidy, when we are trying to detect aneuploidy, along with the dual markers, we use something which is called the NTNB scan. What is the NTNB scan? So, it is the nuchal translucency nasal bone scan. These are two parameters we use in order to detect soft markers of aneuploidy. Alright, when is this done? So again, let's look at the options. So first, done at 11 to 13 plus 6 weeks. Is this true or false? Yes, just like CRL, this is also done at 11 to 13 plus 6 POG. Then, what should be the CRL? This is also very, very important. It is all predetermined. I can only do this scan in between these CRLs and in this period of gestation. So the CRL should be 45 to 84 millimeters. This should be the CRL. Only then I can do this scan. Then fetus should be in mid-sagittal view, same as CRL, same mid-sagittal view, and again no flexion, no extension. The neck should be neutral, and the nasal tip and the hard palate shouldn't be seen in the same view. This is wrong. They should be. This is how I determine that we are actually in the mid-sagittal plane. These are the structures that we have to identify in that image to know that we are in the mid-sagittal view. So let's look at the image. How do we go about measuring the nuchal translucency? As the name suggests, what is nuchal translucency? It is a simple fluid collection which is there in all fetuses. Okay. This increases when there is any aneuploidy. Alright, so this fluid collection, black anechoic fluid collection in the neck that you are seeing, this is your nuchal translucency. How do we decide the plane? So as you can see here, this white bone that you are seeing, echogenic structure, this is the hard palate. What is this? What are we seeing here? So this is the nasal bone that you are seeing. Can you see this nasal bone here? This is the nasal bone. So this is where we measure. Again, we have to be very careful where we place the calipers. So the calipers must fall. The horizontal part must fall on this echogenic line. So this is how we take the exact diameter of the nuchal translucency. Again, this will vary with the period of gestation of what we consider the upper limit. But remember that as a general rule, anything which is more than 3 millimeters is abnormal. Alright, so nuchal translucency more than 3 mm, a bad prognostic sign, and the baby needs to be worked up for any aneuploidy. Alright, so this is NT. Then in the same scan, we also go for nasal bone measurement. So how do we look for the nasal bone? See here, this echogenic thing that you are seeing, this is the nasal bone. Can you see one more echogenic line above this? One more echogenic line? This is the skin above the nasal bone. So you have nasal bone, you have the skin. So these two form a sort of equal sign. Can you see the equal sign that we are seeing? How we draw the equal sign? So this forms the equal sign. And we should see one more echogenic dot, which will be the tip, which will be the nasal tip. So this is how we see the presence of nasal bone. Again, absent nasal bone or hypoplastic, a short nasal bone shorter than 2 mm will again be a sign of aneuploidy. Alright, so we are seeing two things in this particular scan in the first trimester. The thickness of the nuchal translucency and the presence or the size of the nasal bone. So this is about NTNB scan. This is done in conjunction with the dual markers with the age. So combining these three factors, age, dual markers, NTNB ka result, we will generate a risk ratio. That what is the risk ratio of this particular female having the risk of aneuploidy. Alright, so that is how first trimester is approached. Again, to confirm, basically just to consolidate the criteria for early intrauterine fetal demise. So as we discussed, there are two things that we look at. First is the crown rump length. So the crown rump length, if it goes, basically the baby is growing, the CRL becomes more than or equal to 7 mm, but still the heart has not come. This is considered as an early pregnancy failure. The other parameter, the sac, as you see here, the sac is growing. Alright, more than 25 it has become, but still no sign of the fetal pole, no sign of the embryo. So both of these are called early pregnancy failure. Alright, so these two measurements, please remember, CRL 7 mm ka ho gaya, but still heart has not appeared. MST more than 25, still no embryo. So this is a lot of times referred to as blighted ovum. Alright, this scenario where you have this sac but no embryo, a lot of gynecologists call this blighted ovum as well, and here they also call it missed abortion. Alright, where the CRL has become big but no heartbeat. Alright, so this is your early intrauterine fetal demise. Okay, going to the next one, which is from 18 to 22 weeks. Now we are into the second trimester. Here we do a specific scan which is called the level 2 ultrasound, also called as the anomaly scan, or it can also be called as TIFA. What is TIFA? Targeted imaging for fetal anomalies. Alright, so this is your TIFA. So this is 18 to 22 weeks ka anomaly scan. Now as a general principle, remember, in second trimester we measure various parameters for gestational age. Now they will ask you a few one-liners about them. So if I ask you what is the best parameter for measuring gestational age in second trimester, what answer will you give me? Type in your comments what will be the answer for this. What length will you measure for the second trimester? So this is the biparietal diameter. So this is the skull, this is the brain of the baby. We choose a section. Here we choose a specific section where I can see the cavum septum pellucidum, I can see the thalami, and the cerebellum shouldn't be in this plane. Alright, cerebellum shouldn't be in this plane. This specific plane is chosen and I measure basically this length, this biparietal diameter. Alright, so this diameter that we are measuring is the best parameter for gestational age in the second trimester. Although always we will measure all the things that I'm going to teach you, but if one has to be chosen, this is the best in second trimester. Alright, the same thing that you are seeing here, one more measurement we are taking at the same plane is the circumference. This is the head circumference that we are measuring in this particular plane. Moving on, if they ask you another question, what is the best parameter? What is the best parameter for third trimester? What is the best parameter for the third trimester? What will be your answer? Then you have to say this particular length. What is this bone that we are measuring? The bone that we are measuring here is the femur ka length. So this femur length becomes the best parameter for the third trimester dating. Alright, so again, femur length can be measured from one end to the other. We don't take any epiphysis into the measurement. Alright, the other thing that can be measured, the one-liner that will come to you, which is the best parameter for measuring the fetal growth or measuring intrauterine growth restriction, or on the other hand, macrosomia. So basically abnormalities of fetal growth can be determined best by which measurement? What is it being measured here? This is the abdominal circumference. So for the abdominal circumference measurements, again a few things should be kept in mind. We have to make sure that the umbilical cord attachment is not seen, or it shouldn't be there in this plane. What is this structure? So again we have to make sure we are seeing the portal vein and the umbilical sinus in this plane. This is the stomach bubble. So we should see all of these structures in the plane where we are measuring the abdominal circumference. And what shouldn't be there? Kidneys shouldn't come in this plane. Alright, so it should be above the level of kidneys. So this is where we measure the abdominal circumference, and that tells us the best estimate of how the fetus is growing, whether there's IUG or whether there's macrosomia or not. And finally, one measurement, if I ask you, which equals the gestational age, if I just measure that, I have a rough idea of what is the gestational age. That is this diameter. This is the cerebellum, this banana shaped structure. This is the cerebellum, and we measure the transcerebellar diameter. So this transcerebellar diameter roughly equals the gestational age. Alright, so this is that is the only importance of TCD. Okay, so just to briefly summarize that, what is the accuracy of dating? So remember, in the first trimester, we will be most accurate to dating the period of gestation. And what measurement do we use here? We use the CRL, which is the best. For the second trimester, when I ask you, the accuracy drops relatively. Alright, our accuracy in dating would be more inaccurate, around 1 to 1.5 weeks plus minus. Alright, and what parameter will be the best as a one-liner? Then you say that the biparietal diameter is the best. And finally, for the third trimester, we are grossly inaccurate for a period of around 3.5 weeks. But if I ask you a one-liner ki kaun sa use karoge as a best, then it will be the femur length. Okay, so I hope this was it. Basically, I hope you got a brief idea, a brief summary of all the measurements, all the numbers that will be bombarded at you when we study the obstetric ultrasound. So this was just meant as a high review of obstetric ultrasound. Thank you so much. I hope you enjoyed this video. Bye.